ACOG has now published a clinical consensus called Pain Management for In-Office Uterine and Cervical Procedures. This details evidence-based pain management options for in-office gynecologic procedures, including pain medications taken by mouth and local anesthetics used at the time of the procedure. Now, everyone experiences pain differently. I have had some women that have gotten endometrial biopsies and they say that they felt nothing, but endometrial biopsies for most women can be very, very painful. And women having a poor experience in the office, especially with something as important as a biopsy to rule out a cancerous or precancerous lesion, if they're afraid to come back, if they're afraid to get resampled in the future, that puts them at risk. So we need to make sure that whatever sampling we're doing in the office is being done in a way that maximizes patient discomfort. For people that are getting their IUD replaced, it's as simple as asking, how did your last IUD go? Same thing with things like colposcopies. Have you had this before? How did it go last time? And most women tell me that it was awful, but that it was worth it. But that shouldn't make it okay to do the procedure without any pain control. You know, we do tend to minimize pain, I think, as doctors in general, but I think telling the patient to expect some pain does help them cope better. Okay, we can't pretend that everything is going to be painless or a little uncomfortable. Some things are painful, but talking them through that, letting them know I'm going to do everything I can to minimize that discomfort, and letting them know it may not take all the pain away, but it will decrease the amount of pain that they have, also helps them cope better with the procedure.